Hey y'all, so some of y'all might know, but a lot of you guys probably don't know that I am a nursing student. And so I am taking pharmacology, and I just wanted to share some extra resources outside of the level up RN cards that I use. I wanted to tell you guys some easier ways to learn the medications in pharmacology, because pharmacology will be one of the hardest classes that you take in nursing school. There's over 100 drugs that you're kind of expected to know, but I'm assuming once you're in the field, you'll have resources that you can refer to because it's going to be too much to try to memorize. Okay, so let's take this pharmacology chart, for example. So when studying the medications, the first thing you want to do is get them classified by class. So grouped by class. Sorry, not classified by class. But you want to get them all grouped by class because it's going to be too difficult for you to try to actually memorize each med. So when you focus on understanding their classification rather than trying to memorize every individual medication, this will help you to see their similarities and the patterns in their actions and their side effects. So let's take anti-hypertensives, for example. So the common examples of anti-hypertensives would be beta blockers, ACE inhibitors, and calcium channel blockers. All of these are going to lower the blood pressure. So an anti-hypertensive, hypertension means high blood pressure. Anti-hypertensive, the purpose is to lower the blood pressure. Instead of trying to memorize all of the names of the ACE inhibitors like captopril, lisinopril, enalapril, you want to remember what they do, so their mode of action. Also, when it comes to ACE inhibitors, a good way to remember them is that they all end in pril, P-R-I-L, pril. So ACE inhibitors, that ACE, ACE, is actually abbreviated for angiotensin converting enzyme inhibitors. So their job is to inhibit, which is to stop, angiotensin 1 from converting into angiotensin 2. It's an antihypertensive, so it's going to lower the blood pressure, but it's also used to help with heart failure. They dilate the blood vessels. And dilating the blood vessels, open them up. This is what lowers the blood pressure, and it does not directly affect the heart rate. When it comes to the side effects of antihypertensives, just think in your mind, if this drug does what it's supposed to do too well, what happens? So if it's an antihypertensive and it's made to lower the blood pressure, that should let you know that if the blood pressure gets too low, it becomes hypotension. That's a major side effect for antihypertensives. Orthostatic hypotension. You have to be careful. You have to let your patient know, that they don't need to sit up too fast and they can't try to walk and all those different things. They need to turn and sit on the side of the bed and ask for assistance. Other important side effects to know that you're probably going to see on your test, especially the HESI exams, would be edema. So angioedema for the ACE inhibitors, peripheral edema for the calcium channel blockers, and also bradycardia. So one way for me to remember bradycardia is Brady, such as breaks, slowing the heart down too much. Dry cough for ACE inhibitors, as well as elevated potassium. Dizziness. Those are ones that you're going to see a lot when it comes to antihypertensives. As a nurse, and even as a nursing student, you want to know not just the side effects, but you also want to know what you're supposed to do in those moments when your patient is dealing with these side effects, adverse side effects. You want to know how to handle it. You want to know what you should be monitoring and what the next steps would be. when it comes to antihypertensives, you want to make sure that you are monitoring that blood pressure, okay? Keeping track to make sure that your patient doesn't end up having hypotension. You want to make sure that you are monitoring their potassium levels. If it falls between 3.5 or if it goes above 5, that's not good. So you want to know exactly what to do in these times. Facial swelling, things of that nature. Anyway, I will be doing... Okay, so I will be making more videos on this type of content on my YouTube page. So follow me and subscribe. I'm going to go through all of the classes of the medications, and I will be providing all the resources that I use to help me in this course. Thank you for watching. Leave me a comment if you would like to see more of this. Bye.